Uh, this session we are going to speak about the gluteal region. As you know, the gluteal region inferiorly is going to be continued to the transverse gluteal fold. If I remove the skin, this skin consists of two layers, epiderm and derm. If I remove that, here is the hypoderm in histology. What in anatomy we call the superficial fascia. If I remove the superficial fascia, I am able to show you the superficial muscle in gluteal region. They consist of the gluteus maximus. Here, if I remove the gluteus maximus, we are going to look at the gluteus medius, and deep to the gluteus medius, here the gluteus minimus is visible. These three muscles belong to the superficial region, superficial muscle. And in the deep region, we are going to show you the piriformis. Piriformis is one of the muscles. It is going to leave the pelvic region through the greater sciatic foramen. And here we are going to look at the piriformis, superior to piriformis and inferior to the piriformis. From the greater sciatic notch, some of the neurovascular bundle are leaved, such as the inferior gluteal vessels and the nerve and the sciatic nerve. As you know, the sciatic nerve is the thickest and longest nerve in our body. It belongs to the sacral plexus and leaves the pelvic region through the greater sciatic notch and inferior to the piriformis. So the sciatic nerve is visible here. Another nerve that belongs to this region is the posterior cutaneous nerve of the thigh. Again, the posterior cutaneous nerve of the thigh belongs to the sacral plexus and leave the pelvic region, pelvic cavity through the greater sciatic notch inferior to the piriformis. And also the inferior gluteal artery and inferior gluteal nerve. As you know, the gluteus maximus is going to innervate by the inferior gluteal nerve. Here you are going to look at the inferior gluteal vessel and nerve. And as you know, another muscle that are visible here will be the tendon of the obturator internus. These three muscles, 1, 2, 3. This middle belongs to the tendon of the obturator internus, superior to the tendon of the obturator internus. You are going to look at the superior gemellus, and inferior to tendon of the obturator internus, I am able to show you the inferior gemellus. The superior gemellus, inferior gemellus are parallel superiorly and inferiorly to the tendon that belong to the obturator internus. As you know, the obturator internus is leaving the pelvic cavity through the lesser sciatic foramen, and piriformis is leaving the pelvic cavity through the greater sciatic foramen. Now here another muscle that belongs to the deep group of the muscle in the gluteal region will be the quadratus femoris. This quadratus femoris is visible here. Now, in posterior to the thigh, as you know, posterior to the thigh, superiorly will be the transverse gluteal fold, and inferior it is going to continue to the knee. Here, I am able to show you three muscles, such as the biceps femoris. Biceps femoris consists of two heads, the lateral head and to the medial head, and the medial part of the posterior region of the thigh. I am able to show you the semitendinosus. As you know, the semitendinosus, superiorly I am able to show you the muscle fiber, and inferiorly a long tendon. So we call the semitendinosus. And if I remove the semitendinosus, I am able to show you the semimembranosus. The semimembranosus superiorly consists of a membranous part. So we call semimembranous, semitendinosus, and biceps femoris. These three muscles also called hamstring muscle because all of them superiorly are going to attach to the ischial tuberosity. Now here, if I remove the skin and superficial fascia and the deep fascia here, because for the thigh, as you know, deep to the skin we have the superficial fascia. If I remove the superficial fascia, I am able to show you the fascia lata. Fascia lata here, if I remove, so I am able to show you the hamstring muscle. Now I remove this muscle medially and laterally. Here you are going to look at to the artery, the nerve, sciatic nerve, that inferiorly it is going to divide to two branches, the common peroneal or common fibular and the tibial nerve. Tibial nerve and the common peroneal nerve are two terminal branch of the sciatic nerve in our body. The common peroneal is lateral and the tibial is going directly, is going to enter to the posterior region of the or posterior compartment of the leg. Now here you are going to look at to the popliteal vein and popliteal artery. The color of the vein is dark and it is the position is superficial, it is near the skin. And here I am able to show you the popliteal artery. As you know, the popliteal artery is going to be continued by the femoral artery. After femoral artery leave the anterior compartment, after passing through the adductor hiatus, it is going to enter to the popliteal region. Popliteal region is a diamond shape in posterior to the knee. If by a diamond shape, superiorly, laterally is going to be formed by the biceps femoris, medially by the semitendinosus and semimembranosus, and inferiorly, the one of the muscles that belong to the superficial group of the muscle in the leg called the gastrocnemius. Gastrocnemius consists of two heads, medial head and the lateral head. Medial head and lateral head of the gastrocnemius are going to show you the inferior boundary of this diamond shaped region in the posterior part of the knee that we call the popliteal fossa. Inside of the popliteal fossa, one of the content is the tibial. Sometimes this sciatic is going to divide very soon to the common peroneal and tibial, but about this cutoff it is going to divide a little late. And the popliteal vein, popliteal artery, the lymphatic node, the connective tissue also are some of the structures that are going to be found here. Now about the popliteal artery. Popliteal artery has some branch, some of the muscular branch, but one of them called the posterior, superior medial genicular and superior lateral. Here I am not able to show you the superior lateral and superior medial genicular artery. If I remove inferiorly, I am able to show you the middle genicular artery. This middle genicular artery is going to go deep to the knee joint, and it is responsible to supply the cruciate ligament, the oblique popliteal ligament. Another branch that arises from the popliteal artery here will be the inferior medial genicular artery, and also inferior lateral genicular artery. Look at here, inferior lateral genicular artery. Inferior lateral and inferior medial are another branch that belongs to the popliteal artery. But about the popliteal artery also I can show you the sural. Sural, one of the artery is the lateral sural, and medial sural also we have that it is responsible to supply the gastrocnemius medial head. Now